A cataract is opacification or hazing of the natural lens that we're born with. It's cleared like a piece of glass when we're born, and with the years, through a number of chemicals and debris that the body accumulates, it becomes hazy, milky, sometimes brownish in color. And when it progresses, the vision goes down very, very slowly. And most people have difficult time recognizing that they have cataracts. There's a number of cataracts that have a variety of implications. There's some cataracts that are due to diabetes, so if it's untreated, we may not recognize the patient has diabetes. So when we see that type of a cataract, we then can test the patient or send the patient for diabetic testing. Other cataracts essentially reduce your vision, and some can be very, very fast, a matter of months when the vision goes down. In general, most people can tolerate cataracts for a longer period of time. Then what they realize, the problem is that when it happens, you can then fall and injure yourself, especially as you get older, and that's where most serious damage happens, when the elderly fall and injure themselves. The surgical techniques for cataracts today are very elegant. Most experienced surgeons can do the surgery fairly rapidly within a matter of 15 minutes, not even rushing through the surgery. The instrumentation and everything makes it much easier. There are lenses today that are excellent in terms of recovering the vision. Assuming that the patient is healthy and no diabetes and no blood pressure, then we can get back to 20/20 vision with good retina. There are three types, major classes of lenses that could be used. One, just spherical or round, and those lenses give you good distance or reading vision, and depending on how you set it up, they're excellent for most patients. There's another class of lens which corrects astigmatism, which many of us have, and the astigmatism is a nice feature that can then make it much better for the patient to see. You can have astigmatism in a pair of glasses, but it doesn't give you as good a result as when you have the astigmatism inside the lens implant. The last class is a multifocal, or a lens that can let you see for distance and reading. There are a number of these lenses. They're quite good, but they're not perfect, and they're not good for every patient. So the selection of the patient for these multifocal lenses is very, very crucial. If I have an engineer, I'll try and shy away from this type of a lens, because if you get some reflections, it may be the one person that really would not like that lens. And that's where you really have to question the patient as to what they're doing, how they're going to function. Are they going to drive at night? Are they going to drive during the day, or do they drive at all? So talking to the patient is very, very important.